This is Samantha Thomas, and this is my Advanced Health Assessment Nursing 612 assessment video. So my patient today, I already had an emptiest bladder and change for the assessment. We looked at general appearance when the patient comes in, that they're well dressed and groomed appropriately, that we're not having any issues with their appearance or they look disheveled. First thing I'm going to do is go ahead and get us at a vital signs real quick. You can relax. There you go. All right, 136/64. And then do respirations and pulse. And then I'm just going to do these quickly unless there's an abnormality. Alright, so the pulse was 70 and respirations were 18. And then how tall are you?
5'11".
Okay, and then I'll go ahead and do the weight real quick. Alright, 162.4. Hop back up. So we'll start with a quick inspection of the head and the scalp and skull. Just make sure that you don't see any lesions, lumps, masses. Look at the back of the head. I don't see anything, and then I will palpate as well. Just make sure I don't feel any lumps, bumps, any sore spots, anything like that. Palpate the facial bones and the temporomandibular joint. Go ahead and open. Okay. And you just note if there's any pops or clicks or cracks, or if it's painful, which there isn't. While I'm palpating, I'll go ahead and palpate the sinus regions. Just tell me if there's any pain. Press on your sinuses.
None.
Okay, perfect. I look at the external structures of the eyes, ears, and nose. The eyes, make sure the eyebrows are even distribution. They're lined up with the tips of the ears, which they're supposed to be. Eyelashes are all intact. There's no drainage that I see. The sclera and the conjunctiva are clear. There's, again, no drainage. I'm going to palpate this lacrimal apparatus. There's no nodules or bumps or pain. There is some slight swelling and redness on this right lower eyelid, and that was from a bug bite previously the patient's already aware of. So as far as the eyes go, I did the external structure. I'm going to do a couple different things. I'm going to test the 6 fields of gaze, and while I'm doing that, it's going to test the cranial nerves, the trochlear nerve, ocular motor nerve, and the abducens nerve. So I'm just going to make sure that those fields of gaze are intact. So I want you to watch my finger and try not to move my head. Just follow my finger. Alright, so no head movement. His eyes moved and followed my finger perfectly. What I'm also going to do is the cover-uncover test. So I want you to cover, or I'll cover this eye. I want you to focus on the clock back there. What I'm going to do is I'm going to watch the movement of your other eye as it adjusts to focus on the clock as well. And there's no lateral movement of that eye, so that's normal. And again, focus on the clock. And there's no lateral movement of that eye to adjust, so that's good. I'm going to go ahead and do pupillary response. So I want you to look straight at the wall. I'm going to look at the patient's left eye first. And the pupil constricts in the right eye, and the pupil constricts. Then I'll look at the opposite eye. Pupil constricts, and the pupil constricts. That's great. So we know his pupils are round, equal, reactive to light and accommodation, so that's perfect. I'm also going to look at the internal structures of the eye. What I will do is, for the optic nerve, cranial nerve assessment, I will look for the red reflex with the ophthalmoscope, and then I will look internally and look for the optic disc and the retinal vessels. So for your left eye, I'll use my left hand and the left eye. I just want you to look straight ahead, okay? We go in, red reflex, and the optic disc and retinal vessels are intact. You look healthy. Same thing on this eye. And then there's the red reflex when we go in. And the optic disc and retinal vessels again look healthy. There's no discolorations or hemorrhages seen, so that's good. After I do the eye, I'm going to move on to the ears. I palpate the auricles of the ears, make sure there's not any pain or nodules or abnormalities. I'm going to go ahead and look at the internal structures of the ears, and then I will test the hearing. So, external ear canal is not red. The tympanic membrane is pearly gray. Good cone of light, and I can see the bony landmarks. And the patient's right ear. Again, external ear canal looks good, no redness. And the tympanic membrane looks healthy. And good cone of light there. For the hearing test, one of them I'm going to do is a whisper test. So I'm going to have you cover your right ear. I'm going to whisper a word into your left ear, and I want you to repeat after me.
Football.
And we'll do the other ear.
Baseball.
Okay, so obviously you can hear a whisper in each ear. The next test I'll do is the Weber test. I'm going to strike a tuning fork and place it on the top of your head. I want you to tell me if you hear the vibrations in one ear over the other, or if they're equal, okay?
Equal.
Okay. And then for the Renee test, I'm going to test the bone conduction first, the air conduction, and I'm going to time this. So I want you to just tell me when you quit hearing the vibration on the bone, and then again when I move it in front of the ear for the air.
Stop. Stop.
Okay, so 5 seconds and then 11 seconds, so that's normal. We'll do the other ear.
Stop. Stop.
Okay, so again, that was 6 seconds and then 13 seconds, so that was good. It's expected. Since I'm done with the ears, the hearing test, the eyes, and the cover and cover, we're going to look at the nose externally. We're looking at the nose is even and straight. There's no evidence of a deviated septum. There's no obvious drainage. What I am going to have you do is occlude one nostril and just inhale through the other. Okay, and do it on the other side. Okay, so that just ensures me that the each nair is patent. Let me tilt your head backwards. I'm just going to look in each nostril, make sure I can see the mucous membranes. They're not swollen. There's no redness, drainage. You can see the septum and the turbinates intact. It all looks healthy. Okay. After all that, I'm going to move on to the mouth and throat. What I'm going to do is have the patient open his mouth, and I'm just going to visually inspect the mucous membranes, the lips, the teeth. Make sure all of his teeth are intact. There's no chips, cracks, coloration is good. I see the soft and hard palate are intact. Go ahead and lift your tongue. Alright, and all the gums are intact, teeth intact on the bottom, coloration is all uniform. Then I want you to stick your tongue out and say ah for me. So the ah reflex, the uvula lifts midline, isn't deviated to one side, and there are no tonsils present, but there's no swelling or exudate or any redness in the back of the throat either, so that's good. And that ah reflex and the speech, all that is testing the vagus nerve as well as the glossopharyngeal nerve. We don't typically do a gag reflex on patients because it's uncomfortable unless I notice that the ah reflex or the speech is abnormal. We already tested the acoustic nerves. We're going to do some facial nerve testing. Basically have the patient make a few different faces at you. Go ahead and wrinkle your forehead, squeeze your eyes tight shut, puff your cheeks out, smile, stick your tongue out. I want you to clench your teeth. So I noticed that all of those actions are symmetrical on each side. The tongue did not deviate to one side or the other. Those are testing the facial nerves, the hypoglossal nerve, and then the trigeminal nerve as well, the opening of the mouth. So I'll have the patient, just to test the spinal accessory nerve, will turn your head side to side for me, and then up and down. So this does two things: test that spinal accessory nerve, and then it also tests the range of motion of the neck. I do want you to kind of press against my hand, okay, and resist against my hand. All right, so just testing that resistance and that muscle strength, and same with your shoulders. Okay, good. Now next I'm going to have you close your eyes. I'm just going to test the touch sensation. I'll use a cotton ball and I'm going to swipe it across the part of your face, and I want you to tell me where it's at.
Cheek, chin, forehead.
Okay, and the next one I'm just going to test is dull versus sharp sensation. I want you to tell me if that's dull or sharp.
Sharp.
That dull or sharp?
Dull.
Okay, so those sensations are intact. Moving on from that, we're going to move to the neck. What I'm going to do in the neck, just visually inspect. I've got a bottle of water here for you. I want to visualize the patient swallow. Notice if there's any lumps, bumps, masses that I can visually see, and then we'll palpate the thyroid, the carotids, trachea. So I just want you to take a drink and swallow real quick. All right, so I didn't see any masses or anything. What I'll do is I'll start with the lymph nodes, and then I'll move on to the trachea and thyroid. So we'll do the preauricle lymph nodes, postauricle, the occipital, tonsillar, submandible and submental, the superior or superficial cervical chain, the posterior cervical chain, your deep cervical chain there, then your supraclavicular, your infraclavicular. And while I do lymph nodes, I go ahead and do the axillary. Just lift your arm right there, and just up here. Don't feel any lymph nodes, and then here. No masses or enlarged lymph nodes there. So after the lymph nodes, I am going to move on to the trachea, and I palpate that it's midline. I don't see any deviations. And then I want you to take a drink of water and hold it in your mouth. I'm going to assess a thyroid gland. So I'm going to deviate the trachea a little bit, and I want you to swallow while I palpate. Okay? And I didn't feel any masses or lumps, and I felt that the thyroid moved freely when he swallowed. Another sip. Hold it. And same thing on this side. Swallow. All right, so same thing on that side. It moved freely. There were no nodules, lumps, no enlargements. I'll palpate the carotids on each side separately. And those are even. And I'm going to just tilt your head just a little bit. And I don't notice any jugular vein distension on that side or the other side. So after that, I'm going to go ahead and auscultate the carotids and the thyroid, make sure I'm not hearing any bruits or pulsations there that are abnormal. So just kind of tilt your head a little bit that way. Thank you. Okay, and the other one. And just slightly extend your neck a little bit. All right, and no pulsation. pulsations or anything heard there, so that's good. Moving on from the neck, I'm going to go to the shoulders, arms, hands. I already had him shrug his shoulders. Go ahead and have your arms straight out. I want you to resist and resist. Perfect. And I want you to bend your elbow joints and your wrists. Perfect. So I know that those joints have active range of motion. I know the temperature in the extremities are the same, and the peripheral fingers. I'm going to check the capillary refill, and we'll do the radial pulses and brachial pulses. And I like to do them bilaterally, make sure that they're even on both sides and they're all moderate. Perfect. The only difference in this assessment is the third digit on the right hand. Left hand, I'm sorry, was injured, so there's no nail bed, but we do assess that, there's blanching and the temperature is the same as the other digits around it, so that's good. Hair is distributed evenly as well, which is a good thing to note. After that, since I'm already on the arms, I'll go ahead and try to get a brachial reflex. Sometimes this is hard when someone has arms a little bit larger than yours. Just let your arm be totally dead in line. And I can feel it kind of jump, but it's not showing much. Just look around good. And that one I can't really feel too much, but again, it's kind of hard. So I would say those are probably 1+ or just a little diminished. We'll move on from the arms, and we'll go ahead and go on to the chest and lungs. And what I'll do is I just inspect first, make sure there's no abnormal pulsations that I see, no lumps, bumps, masses, anything that I can see. The contour of the chest is symmetrical on each side. The chest wall expansion is symmetrical. There's no labored breathing, so that's all positive. And then since we're already facing front, I'll go ahead and just palpate the chest right here, make sure there's no pain or tenderness along the sternal border. And then I want you to go ahead and repeat the phrase 99.
99. 99. 99.
Okay, so you just check for tactile tremitus, make sure that I can feel the vibration of that on both sides, which I do. I didn't feel any pulsations or heaves or thrills while I am palpating the apical impulse. Don't feel any of that, so that's good. And then we're also making sure we get those clavicular lymph nodes too while we're doing that. After that, what I'm going to have him do is I'm going to have you turn around, and I'm going to do the same thing with the back, the posterior chest wall. I'm going to look, contours even, chest wall expansion in the back and scapula rising evenly, no labored breathing, palpate, make sure there's no pain or tenderness, lumps, bumps, or masses, and just repeat that phrase 99.
99.
Again?
99.
Yeah.
99.
Alright, so I feel the tactile frontis in these upper lobes, the lower lobes a little bit harder to feel, which is normal. I'm going to go ahead and grab my pen. Alright, I'm going to go ahead and percuss over the lung fields. I should hear resonance in all these lung fields. So just breathe normally. Okay, and go ahead and lift your arms up a little bit. Alright, so if your resonance in all of those, so lean forward just a little bit. What I'm going to do now is just go ahead and take a deep breath. And I'm just looking at that thoracic expansion and watch my hands move evenly and apart together. So I know that there's even expansion on both sides. I'm going to go ahead and percuss at this crossovertebral angle here. Any pain or tenderness?
No.
Okay. Next, I'm going to measure the diaphragmatic excursion. So what I'm going to do is start with this midclavicular line, and I want you to take a deep breath and hold it. Okay. All right, you can release. I'm going to do that on this other side as well. Deep breath, hold it. And release. All right, and then I'm going to have you go ahead and take a deep breath in and exhale. When you exhale, I want you to hold it. Alright, you can breathe normal for a second. Alright, and do the same thing with exhale. Alright, you can breathe normal. So now I'm just going to measure these spots that I marked for the diaphragmatic excursion. So this one's measuring about 4 centimeters. That's good. This one's measuring about 5 centimeters, so that's good. Anywhere between 3 and 5 centimeters is a normal measurement for that diaphragm movement. So now that I've palpated, I've percussed, I've done the diaphragmatic excursion, did the costovertebral angle, I'm going to go ahead and auscultate. I just want you to take a few deep breaths. Okay, and while I have my stethoscope, I'm sorry, I want you to repeat that phrase 99.
99. 99. 99. 99. 99. 99.
Okay. So what I'm doing is making sure that that's an indistinct sound, it's muffled, I don't hear any nasal quality, and I'm not hearing it clearly, which would be an abnormal finding. So I'll go ahead and have you face me again. And, yeah. I already percussed and palpated the front chest and the lateral chest wall, so I'm just going to listen now. Take a few deep breaths. Should I go ahead and lift your arms a little bit and I'll listen to that again. You can breathe normal. And I want you to repeat that phrase 99 again for me.
99. 99. 99. 99.
So again, muffled and indistinct. All your lungs sound clear. No crackles, wheezes, rails, anything like that. So that's good. After I'm done with the lungs, I'm going to move on to the heart. I already checked for jugular vein distension. No need to measure any of that in this patient. But what I will do is I'll listen to the heart in 5 different spots, listen for any murmurs, gallops, clicks, any extra heart sounds, anything like that. So you can just breathe normally while I do this. Right, so the heart rate is regular and even. S1 and S2 are present. There's no extra heart sounds, murmurs, gallops, erupts, anything like that. So that's good. Along with the cardiovascular assessment, we already did peripheral pulses on the upper extremities, and we'll do that on the lower extremities as well when we get there. So now that the heart and lungs and chest, all of that is done, I'm going to go ahead and move on to the abdomen. So go ahead and have you lay down, your head facing in there. Your side, please. And then what I'm going to do for the abdomen assessment, I'm going to listen first before I start percussing or palpating anything. I'm going to listen all 4 quadrants, make sure I hear bowel sounds, and then I'll move on to the arteries and see if I hear any abnormalities there. We'll start with bowel sounds. All bowel sounds are present in all 4 quadrants. Then I'm going to move on. I'm going to try to listen to the aorta, make sure I don't hear any bruits. Beats or growls. Sure none of that's present while I'm inspecting as well. I'll move on to the renal arteries. Something's a little hard to hear. Again, make sure there's no bruits or abnormal pulsations. And the iliac arteries. And the femoral arteries. Okay. So that sounds normal. No bruise or anything in any arteries. I'm looking just as an inspection. I notice that the contour of the abdomen is even. I don't see any thrills or pulsations that would be abnormal. I am going to feel for that aorta midline, just to make sure that I don't feel anything abnormal. And then I will do percussion first, and then I will palpate the organs. So I'll just start with over each organ. Specifically, I should hear like dullness over the liver, spleen, and then resonance pain over the intestines. So here's that splenic dullness down here. A little bit more resonant over these intestines. Alright, and then I'm going to palpate. I'll start with deep or light palpation and move on to deep palpation. And just make sure, tell me if there's any pain or discomfort with palpation. I'll move on a little bit deeper palpation, try to get to that liver border. It's just hard to feel. The spleen I don't expect to feel, try to capture it, but same with that left kidney, rarely really feel it, and that right kidney, feel a little bit, it's smooth, no messes. I will go ahead and measure the liver span. I'm just going to rest that right there on your stomach. So I want you to go ahead and take a deep breath in and hold it. And I'm going to wait till I hear that dullness. Okay, and relax. Alright. And I want you to take another deep breath in and hold it. Getting when I hear the dole. Okay, and relax. So I'm going to measure the liver span. I would expect it to be anywhere from 6 to 12 centimeters for a normal liver. And this is right at 7 centimeters, so that's good. And anything larger than 6 centimeters, I'd be worried about liver enlargement or displacement with other pathologies, but all looks good there. So after the abdominal assessment, I'll go ahead and have you sit up for me and face this way. We'll move on to the lower extremities and the legs. Look at the even hair distribution on both sides. The warmth is the same. I'll check pulses. We'll do pedal pulses, posterior, and then posterior tibial pulses, which are even and moderate. And we'll try to do popliteal pulses. A little bit harder to feel, but and I would say those were weak just because they're a little bit deeper and hard to feel. We'll go ahead and check our patellar reflexes. Yeah. There we go. All right, so those would both be B2 plus or normal. I'm going to have you straighten your legs out just to look, okay, we have good joints. Go ahead and push up against me. Okay, push down. Okay, and push against my hands. And then back against my hands. All right, so strength is even on both sides. So I'm not worried about the musculoskeletal. We've got active range of motion on all joints, no pain or swelling in any of the joints. So that concludes our assessment.